Obesity, a predictor of outcomes of COVID-19 hospitalized patients, a systematic review and meta-analysis. Obesity, defined by elevated body mass index, is a global epidemic, with 4% increment in prevalence from 1990 to 2019. 5.02 million deaths, and 160 million disability-adjusted life years in 2019. In the United States, the prevalence of obesity increased from 30.5% to 42.4% and is a known risk factor for various diseases. COVID-19 pandemic has posed a greater risk to population and healthcare. A few recent articles have begun to explore the relationship between obesity and COVID-19. In this meta-analysis, we assessed the association of obesity and outcomes in COVID-19 hospitalized patients. Data from observational studies describing the obesity or body mass index and outcomes of COVID-19 hospitalized patients was extracted following PRISMA guidelines. Adverse outcomes defined as intensive care units, oxygen saturation less than 90%, invasive mechanical ventilation, severe disease, and in-hospital mortality. The odds ratio and 95% confidence interval were obtained, and forest plots were created using random effects models. A total of 10 studies with 10,233 confirmed COVID-19 patients were included. The overall prevalence of obesity in our study was 33.9%. In meta-analysis, COVID-19 patients with obesity had double the risk of poor outcomes. Our research findings suggest that patients with obesity are at higher risk of COVID-19-associated poor outcomes. Hence, there is need for increased surveillance, priority on early detection and testing, and aggressive therapy for patients with obesity and COVID-19 infections. For more details, below is the link for this interesting study. Please review it. Follow us for more videos related to research interpretation.